My name is Roham Zamanian. I'm the director of the adult program at Stanford University Medical Center, the Adult Pulmonary Hypertension program. CTF refers to chronic thromboembolism as a cause of the pulmonary hypertension. And it's often a very strong mechanical obstruction that, when surgically approachable, is completely curative. And so the difference between PAH and CTF is that while the vascular changes may occur that are similar between the two diseases, CTF has to be seen as primarily a vascular obstruction from a clot or organized clot, and the first step should always be consideration of surgical removal of that clot. That's how it's different than PAH, because PAH ends up being a very definitive vascular disease. There is no surgical options currently for PAH that has to do with the removal of the neoentima that's formed, and really that's why it's a medical therapeutic approach in PAH. So I think that once you recognize the pathobiology of the two and how they're similar and different at the same time, you recognize that, again, the first and foremost important thing that you have to think about is a chronic thromboembolic PH patient, do they have the option of surgery or not? So the workup of a patient with CTF begins in a very similar pattern with a screening echocardiogram as we do for PAH. But very quickly, we must do a nuclear evaluation to see if there is clot disease. And if there is clot, then what I've learned is that there must be angiographic determination of the extent of the blood clot. So you will be doing pulmonary angiography during the right heart catheterization, sometimes even advanced nuclear and MRI technologies to determine the sort of the mapping of the clot and if it could be approached surgically. And then, soon after, it's determining whether medical therapy should be added before surgical consideration is surgical evaluation it takes place. So that's the general approach to a CTF patient. A PTE surgery is pulmonary thromboendarterectomy, and it's a open heart bypass surgery on pump where the surgeon goes into the lung, into the blood vessels of the lung, dissects very carefully around layers of the blood vessel and into the blood clot, and tries to scoops that blood clot and chronic clot and organized clot and webs and all these things that happen with chronic blood clots out of the lung so that there is flow of blood past the areas of blood clot. That's what a PTE is. Up to now, the exchange of information, the discussions around the care of the patients with chronic thromboembolism and pulmonary hypertension has taken place in small forums, small journals and publications. But when we come together in a forum like this, we ask questions that you might think are not important, but become super important. You make connections, you learn from each other, you learn from latest practice guidelines, you learn from experts in the world that you don't have contact with every day. So that's really what's important about it. The nurses also recognize the collaborative nature of this rare disease community to begin with, and that's not something that you could get when you're sitting all alone in your office trying to read a publication. So I think that's why conferences like this are super important and very helpful for both physicians and practitioners. It used to be fairly rare, maybe 2 to 3% of our PH evaluations were for CTF. Over the last 3 or 4 years, we've had a tremendous increase in the number of patients that are referred to us. So we're at about probably 1 or 2 patients per month even, which is a huge increase for us. And I think that there's general educational programs that are taking place. The physicians are reading the publications that are coming out more about chronic thromboembolic disease and pulmonary hypertension. They're realizing that acute pulmonary embolism can lead to chronic disease in a certain number of cases. So we've had a tremendous increase, and I think that that's why it's important for me and my team who are here and some of our advanced practitioners to be here to learn more about this disease and its potential therapies. I think that it's very complicated. Data has already shown now that the time to diagnosis for CTF is similar to PAH in the order of 18 to 24 months. So it's very, very sad, And I think that the other issue specifically around thromboembolism is that maybe there are times that a physician treats a patient with what they think is an acute pulmonary embolism, but never works it up and follows it up to see. So I think that data will come out more, but I think it's generally similar, unfortunately, to PAH.